Reproductive health means physical, emotional, behavioral, social well-being in all aspects of reproduction. And what was the need for the reproductive health? Need can be physical need to take care of your own reproductive parts, prevent yourself from sexually transmitted disease, and if it is motherhood, means to have a safe motherhood. And if the couples are facing infertility issues where they are not able to bear children, then about infertility treatments, they all should have knowledge about. So the one need for reproductive health is a physical need. Second, the mental health. Need for sexual relationship practiced in safe and responsible manner. Need to practice honest, non-exploitative, mutual sexual relationship. Need to practice honest means if you have a life partner, to be honest with your life partner. That's the meaning of that, honest. Non-exploitative means it should not be based on rape-like things. It should be based on mutual consent. That's called non-exploitative mutual sexual relationship. Social need is there should be gender equality. If suppose you have two children, one male, one female, treat them equally with respect, and you accept the opposite sex who's studying with you or working with you or living with you. Emotional need is need for respectful, responsible expression of love. Telling about this responsible expression of love means some people they mistake what actual love means. Like you're going to propose one of your opposite sex, male or female, you're going to propose. If you give them threatening, if you don't love me back, I'll kill you. Or if you don't love me back, I'll kill myself. So that is not a responsible expression of love. So that we should know how to deal emotionally. Then freedom from forced sex that I already mentioned along with mental health. Decision making skills. Like if the couple is already having one child, if you don't want a second child, both should go for a decision. Both the life partners should involve in the decision. Then communication for good personal relationship. If there is any problem existing between the opposite sex and yourself, communicate, talk and deal with the relationship. That all comes in emotional. So these are the needs of reproductive health: physical, mental health, social, emotional. Any doubts come in between, you can ask. Feel free to ask. If I know, I will tell. If I don't know, later I will search and tell. Now this is reproductive child healthcare programs. India was the first to introduce this. Socially, they are very serious about this. So the two tasks they stressed upon, two major tasks about this program is to create awareness about the various reproduction related aspects. Second is to provide facility for building such a healthy society. Now create awareness, how did they achieve is like this. Both the government as well as non-governmental agencies contributed to this. One is introducing sex education in schools so that the children will not believe in false things about sex related aspects. So teachers will teach and they discuss with the children so that any doubts are there, that will be cleared in the correct way. Next is to give information about your own reproductive organs and what all changes happens during adolescence, to be prepared for all those changes. Like I've heard that when you first start to inseminate, semen comes out, or when you start getting your periods first, children they get scared thinking it is something unusual. So it's better to get sex education so that you will understand that they are normal part of your life. So adolescent related changes. Next is what are the sexually transmitted diseases and how it can help them lead a reproductively healthy life. Like what happens is when any sexually transmitted diseases come to them, they are not going to the doctor. Now, if they don't go to the doctor, these diseases will spread from genital organs. It will go further inside to the other organs. Like it will go further into kidney, liver, stomach, then it will become more problem. So it's important that any of diseases come, any symptoms you see, immediately without becoming shy, you have to go to gynecologist. They will prescribe medicine for you. Educating marriageable age groups about the birth control options. See, there are so many birth control options. Everything is not applicable for all people. So they have to get knowledge about these options and choose whichever is good for them. Care of pregnant mother, postnatal care of mother. Postnatal means after mother gives birth to baby, how to take care of the mother's health. Importance of breastfeeding. Here also, some mothers after giving birth to babies, they don't like breastfeeding because they don't think it is needed. They feel children will be more dependent on their mothers. They can't go for job. That might be one reason, but it is actually wrong. They say breastfeeding will increase the bond between the child and the mother. So they will develop trust. The child after growing a little bit, they'll become independent because whatever bond they have established, that trust is there with your mother, then they'll be more courageous type of individual. So there is some, and breast milk colostrum gives antibodies so that they can fight against the diseases. So that is importance of breastfeeding. It is important. Equal opportunities for male and female child. Awareness about social evils like what is sex abuse, sex related crimes. This I had discussed last class. Problems due to overpopulation. Help to build up social healthy society. So these are the topics about which government and NGO they educate. This is all points taken from NCERT text itself. When you read through the paragraphs, you will get these points, okay? Next, task two tasks were there, no? Second task was to provide good medical facilities. So that is like this: medical assistance to people in reproduction related problems like pregnancy, delivery, sexually transmitted disease, abortion, menstrual problem. For all this, medical assistance. Ban on amniocentesis, that last class I had told. Amniocentesis was actually a good practice. What they do is the amniotic fluid surrounding the fetus, that will be taken and they will look under the microscope. They will see if there is any genetic problems for the yet to be born child. Genetic problems like Down syndrome, where there will be mental retardation and all. Or hemophilia. Hemophilia problem means where their blood will not clot. So it is also called bleeder's disease. Or sickle cell anemia. It's a kind of anemia where red blood cells will be not round, it will be sickle shape. So these problems are there or not. If it is there, whether it can be cured or not, all this they can understand if you check the chromosomes in the amniotic fluid. Since the amniotic fluid is touching the embryo's skin, they will get some skin cells inside this. But this technique, it was actually good, but it was misused. Instead of finding for problems, what they did is chromosomes were used to check the sex of the baby to be born. If they find cells are having XX chromosome, that is female, they kill the baby. So that is why this practice is banned, ban on amniocentesis. Then about the oral contraceptive, usually oral contraceptives should be had every day except menstruation time. It prevents ovulation. We'll be learning now. Now, Saheri is an oral contraceptive. It's a once a week pill. So only once in a week you have to have that. It is a contraceptive. Then there are also medical facility for reducing maternal infant mortality rate. Mortality means death rate. So to reduce the mother's death and baby's death, usually it happens during childbirth. Either the baby will die due to some reasons like umbilical cord will surround the baby's neck when the baby is coming out, then the baby will die. Or mother will get intense bleeding is not getting stopped, then it will lead to mother's death. So all these used to happen earlier because earlier they never went to hospital much and some hospitals did not have adequate medical facilities. Nowadays it is there. So there are medical facilities to reduce maternal death and infant death by giving better postnatal care. Natal means after birth care. Better detection and cure for STD, sexually transmitted diseases. They know how to find out whether you're suffering from sexually transmitted disease earlier itself, and then they can prescribe medicine for you.
Population.
Yes. So you can see that population is increasing over the years, which is also called as population explosion. Population explosion means there is so much of increase in population. And do you know what is the India's present population? Any idea what is the condition of India's present population? Roughly, you can say. Is it in thousands or is it in lakhs or is it in million or billion? In what?
40 crores. 132 crores.
Okay, you have told 132 crores. Okay, that is an Indian place value. Now, if you see an international place value, it comes around 1.3 billion and more than that. It's still going on. So we are in billions now. And I think we are the second highest after China. So our population is expanding this fast. Can you tell me what might be the reason why our population is so high? Why there is population explosion in India now? Any reasons? Can you cite? Why it's so high? You assume and tell.
The birth rate and death rate is balanced, ma'am.
Yes. Actually, earlier, birth rate was low. As I told you, earlier generations means the medical facility was not there good. So during birth itself, some babies will die. Nowadays, the birth rate is high because of good medical facilities. So medical facilities are good nowadays. Medical facilities are high, that's why. Similarly, the maternal death, maternal mortality is also less. Mothers are also alive after birth. Maternal mortality is also less. That is again due to medical facilities. What are the other reasons why the population is so high? Why the number of children produced is high? Why? This is two reasons. Now we'll see what are the other reasons. So these are some of the reasons. The current population of India as per July 16, 2020 is this much. Now you calculate this: 1, 10, 100, 1,000, 10,000, 100,000, 1 million, 10 million, 100 million, billion. It's around 1 billion. This much is there. So it due to decline in death rate. Now our death rate is less. Due to decline in death rate, maternal mortality rate, infant mortality rate. Infant means baby. Infant mortality rate. Increase in number of people is there in reproducible age. So the reproducible age itself is high means That is the reason why the population explosion is there. But there are so many problems. If the population grows like this, there will be scarcity of food, shelter, clothing. You know, every couple, if they want to have a house, there should be space for that. Land is not sufficiently present in our country. And if it's a family, means more numbers in a house, more they have to share the food, they have to share the clothes. So there will be scarcity of food, shelter, clothing. Next is there won't be sufficient job opportunities for this increasing population. So there will be unemployment. And if there is unemployment means no job. If there is unemployment, then you will have low standard of living. Low standard of living means they don't have money to buy the things and wear. So their standard of living will be low. They won't have transportation facility. They can't have money to pay for electricity. They won't have money to pay for water. So many problems are there. So they are low standard of living. Then poverty. Poverty, they're poor. They don't have food to eat. And when these above problems happen, some people will turn negative. So they're involved in social problems like this robbery. Children, you're able to see this slide, no?
Yes, ma'am.
Okay. So there'll be social problems like this. Some of them will turn to become robber. Some will do beggary. Now, anyway, it is prohibited. But these are the reasons why they resort to beggary. Murder. They'll find some way to get the money. And in order to avoid being caught, they'll murder also. And when there is more number of people like this, they will all buy transport means which will all emit poisonous smoke. So it lead to pollution. Traffic problems comes, traffic congestions and pressure on environment. Like they want, all of them want electricity. They need electricity. They have to use more water, dams. Then they'll start cutting the forest and they'll start cutting the forest to build houses. So there's a lot of pressure on environment. So these are the problems which happens due to overpopulation. Overpopulation is called population explosion. This much food only is there. Father brings. This many children are there to share means they all will not get. That's why we have to reduce the population. This is what you see. The countries just show red. They show high population density per square kilometer. Now India is there one. India is there here. Some countries are there here also. Now what is the solution? Solution to overpopulation. Motivate smaller families by using contraceptive methods. Small families are always good. So how to make small family? Use contraceptive methods. Advertisements in the media showing the importance of small family. One child norm. One child norm means one child rule. China was using that. That's why little bit their population density lowered, the rate lowered. One child norm. And statutory raising of marriageable age of female to 18 years. Earlier generation, they used to marry off the female at 13 years, 14 years. So earlier itself, if they are getting married, not only that their education is blocked, but number of children produced in the family would be more than 10 maybe, which will affect the health of the female, of course. So that's how the population became high. So that's why to increase the marriageable age of female to 18 years and the marriageable age of male to 21 years. Other step is incentive given to couple with small families. Incentive means some kind of financial benefit to those couples who's having smaller families, like in government small family. Now, the first method to control was to use contraceptive. Now, contraceptives should be ideal, means it should be user friendly. If it is user friendly, it should be easily available. It should be effective. That means effective means it should prevent pregnancy. That's the meaning of effectiveness. It should be reversible. Reversible means suppose for time being for 3 years, the couple, they don't want children. After 3 years, they want one child. It especially happened during natural disasters, like during tsunami. You know about tsunami, no? Tsunami, you have heard, no?
Yes, ma'am.
So during tsunami and all, it happened that some couples lost their children to the waves. So they were left without any children and they wanted one child after that. So they have to use such kind of contraceptive where once they want to have a child, it can be reversed and they can produce a child. So it should be reversible and contraceptive should not have any side effects and it should not interfere in the sexual drive of the user. Sexual drive means sexual interest of the user. It should not interfere with that. It means that it should not cause any injury to the user. So these are the characteristics of ideal contraceptives. It should be user friendly, easily available, effective, reversible, no side effects, and yet not interfere in sexual drive of the user. So this we will be learning now. These are the different contraceptive methods. So there are these all methods are there. Little bit you have learned in class 10. Now we are classifying it in different headings. Like there are naturally available contraceptive method. Another is barrier method where they block the meeting of sperm and ovum. That is called barrier. Like in our school, there is a fence. Fence is there, fencing wall is there. It acts as a barrier between the school campus and the outside. like that. There are barrier method. Third is intrauterine device. Intra means inside. There are some devices like this in the picture, this one, intrauterine device. This is inserted into the uterus. It is inserted only by the doctors, and they can prevent pregnancy. Then comes oral contraceptives. Oral contraceptives, it first started with female oral pills. Nowadays, I have also read that males are also having that. But yes, according to textbook, it is about female only. Oral pills are there, they cause hormonal changes and it will prevent ovulation. So if ovum is not there, means sperm, even if it gets inside also, there won't be pregnancy. So that is the basis of oral contraceptive. The same oral contraceptive, what chemicals are there, sorry, what hormones are there, that same hormones can be given in the form of injections or it can be given in the form of implant. We will be coming across all this in detail. So far, natural, barrier, IUD, oral contraceptive, injectable, implant, these methods are reversible methods. Reversible means if the couple wants to get a child, they want to be pregnant, they can do that. But the last method is irreversible. It is called surgical method, where there is cutting of vas deferens and tied so that the sperm which is released will not come out of penis. So the sperm is not coming out of penis means it will not get into female reproductive tract and make her pregnant. Same way, tubectomy means cutting fallopian tube, a small portion, and tied. So that ovary, when it is releasing the egg, that egg should not reach isthmus ampulla junction. It should not reach isthmus ampulla junction. So it's blocking there. Egg will be blocked. So even if the sperm enters into fallopian tube, it cannot meet the ovum. Now here it is involving surgery. So it is difficult to reverse it. It is irreversible. Yes, latest reports are there. Vasectomy can be reversed a little bit if the male is healthy. Latest one, but according to textbook, both are irreversible methods, vasectomy and tubectomy. Now this in detail we have to learn one by one. These are the different contraceptive. Take a notebook and write, okay? You're writing, no, children? Are you writing?
Yes, ma'am.
Yes, ma'am.
Now, natural method. Now, each method is based on some of the other principle. So, the natural methods principle is like this. It avoids the meeting of sperm and ovum. Avoids meeting of sperm and ovum. See the spelling of principle, P-R-I-N-C-I-P-L-E, okay? Not P-A-L. P-A-L means our school principle. Avoids meeting of sperm and ovum. This is the principle behind natural method. Now, there are different types of natural methods. The first type is called periodic abstinence. Periodic abstinence. Periodic abstinence. Now, first of all, we have to know what is abstinence. Abstinence means to abstain from sex. To abstain from sex. And what is the meaning of abstain? Abstain means what? Any idea what is abstaining from sex means? Abstain means to avoid, to don't have sex, to avoid having sex. That is the meaning of abstinence. Now they have written here periodic. Which time couples should avoid sex if they don't want to be pregnant? What is the time period? That you guess and tell me which time during the menstrual cycle, which phase during the menstrual cycle, the sex should be avoided to prevent conception. Which is the time?
After
43 to 23, ma'am.
Good, very good. So during the 14th day, ovulation takes place. So ovulation takes place. If the sperm reaches, then they will be conception will take place. So roughly, and I told you, practically at least 2 or 3 days before the 14th day or 2 or 3 days after the 14th day also ovum can be released. So roughly they have calculated the period between 10 to 17 days of menstrual cycle. The period between, in this 14th day also comes 10, 11, 12, 13, 14, 15, 16, 17. The period between 10 to 17 days of menstrual cycle is regarded to be the fertile period in the female, fertile period. Because there are chances that during those days, ovulation takes place, 10 to 17 days, ovulation takes place. So that's why to avoid sexual intercourse or coitus during those time period. So if there is no sexual intercourse during 10 to 17 days of menstrual cycle, then there won't be pregnancy. Now, that is one way, but we have to find out whether it is a reliable method, whether it can be depended or not. No, you cannot rely it. It is not reliable. Why? Because we only know roughly know whether 10 to 7. What about 18th day? What if ovulation takes place on the 18th day? So it's not that reliable, but it is one of the methods used by the couples, natural methods. Now, what about side effects? Any side effects will be there when you're following this? Any harm?
No side effects.
Yes, that is a good thing here. No side effects are present. And whether it is reversible means if you want to have child, can you reverse it? Is this method reversible?
Yes, ma'am.
Yes, it is reversible. So it is reversible. They don't have side effects. That are the positive sides. But reliability is not there complete because it's based on chance. We are assuming that 10 to 17 days ovulation takes place to avoid sex during that time. That's called as periodic abstinence. So this is one of the natural methods. The next natural method which the couples rely on, next one is called as withdrawal method. Withdrawal. Withdrawal method is also called coitus interruptus. Withdrawal method is also called coitus interruptus. Coitus means sexual intercourse. Interruptus means sexual intercourse interrupted, disturbed, which means that the male partner has to withdraw his penis. Male partner withdraws. Withdraws means take away. Male partner withdraws penis from vagina of female. When? Before ejaculation. Ejaculation means when sperm is produced, no? When semen is produced. Before ejaculation means before insemination. Before insemination, at that point of time, if he is withdrawing the penis from the female reproductive tract, then semen will not get inside her body. Semen will not get inside the female's fallopian tube. If semen is not getting inside, means no sperm, so no meeting of sperm as well as egg. So this is the method. Here the principle is to avoid insemination. That is the principle here. It avoids insemination. So if there is a vagina here, this is suppose vaginal opening and the penis is inserted, means before the insemination takes place, the penis has to be taken out. It has to be withdrawn. Insemination's other word used is ejaculation. So that is withdrawal method or coitus interruptus. That means sexual intercourse will take place, but when it is about to reach insemination stage, that time penis has to be withdrawn so that the semen should not fall onto the female reproductive tract. That is the method where we are stopping the insemination. Now to find out the reliability and other factors of this method, how much it is reliable? Is it reliable? Can you depend upon this to prevent the pregnancy? Any idea, children? According to what definition you have seen, do you feel that it is a reliable method? It's okay even if your answer goes wrong. Do you feel it's a reliable method?
Not reliable.
Yes, it is not reliable. The reason is that sometimes the male might not know whether semen has already got inside or not. He might be withdrawing the penis, correct? But before withdrawing his penis, some semen might have got access into the vagina. So it is not reliable because of that reason. But the other factors are positive. There is no side effects because they are natural method. Natural methods always no side effects. So the last natural method, we'll go for the last natural method. Last one is, with this I'll end the class. The remaining we will deal with in the next class. Last natural method is lactational amenorrhea. amenorrhea. Amenorrhea means absence of menstruation, no periods, absence of menstruation. And since there is no menstruation, it is also absence of menstrual cycle. That means no periods means no ovulation also. Both will not be there if there is lactation, intense lactation after childbirth. After childbirth. So it happens after parturition. The other word for childbirth is parturition. No? So after parturition, if the mother, after delivery, if mother is intensely lactating, the word intense should come there. After parturition, mother is intensely lactating. Lactating means breastfeeding, lactating the infant. Then this situation comes. There will be absence of menstruation, absence of menstrual cycle. So the chances of conception is not there. Now, what is the meaning of intense lactation? What's the meaning of intense lactation, children? Any idea? What's the meaning of intense lactation? Simply lactation means breastfeeding. What's the meaning of intense lactation? Only if there is intense, only this will affect. This can prove as contraceptive method. Okay, I'll tell you if you don't know. Intense lactation means that doctors will advise to breastfeed the baby once the baby is born. For up to 6 months to 7 months, the baby can be lactated without even giving the baby water. No water, no cow's milk, no other replacement. And it is proven to be healthy also. 6 months or more than that, the baby needs to be lactated intensely without any supplemented food. No giving other than this, no other solid food, no water, no cow's milk, because a mother's milk itself will have all these ingredients. Water, nutrients will be present. So that is called as intense lactation. If this intense lactation is going on, then the mother will not have menstruation. No menstruation, no menstrual cycle. That means no ovulation. So it serves as a method of contraception. But there are problems. The limitation of this method is, it works up to 6 months only, 6 to 7 months only after parturition. If the mother is intensely lactating only. If the mother is lactating and then sometimes she will give the baby water, or sometimes she might give some other semi-solid food, then this method will not work. So the limitation is it works only up to 6 months, even if you're intensely lactating. But yes, side effects, no side effects. It is safe method. But how much it is reliable? It is not reliable. It is not reliable because when she will start getting her menstruation, before she gets her menstruation, sometimes ovulation might have happened, which the mother is not able to know. And at that time, if she had a sexual intercourse, she might get pregnant immediately. So that's why it's not reliable. If it is reliable, means it works up to 6 months. After the 6 months of intense lactation, she will have her menstruation. Usually, according to research, that is what is